I want to take this moment to talk a little bit about sunscreens and answer some common questions that patients ask us on a daily basis. As dermatologists, we always recommend that patients wear sunscreen or sun protection clothing that carries a rating of SPF 30 or higher. One other thing we tell our patients is to try to wear sunscreen on your face every day, even when you're just commuting to and from work. This is important in not just prevention of skin cancer, but prevention of brown spots and prevention of photoaging. I tell patients, try to make it a habit, like brushing your teeth. Put that sunscreen bottle next to your toothbrush and that'll remind you to put your sunscreen on your face every day. Patients may say, well, what about over 30? And I say that after 30, the efficacy of the sunscreen doesn't matter that much. So just shoot for that number to be an SPF of 30. Another important fact is that sunscreen does start to wear off after 2 to 3 hours, especially when you're out in the sun playing golf, playing tennis, or outside at the beach. So just remember to reapply every 2 to 3 hours. Lastly, another common question is what's the difference between these physical sunscreens that are also known as mineral sunscreens and chemical sunscreens? They both work. There are some people that are sensitive to chemical sunscreens and can break out, but that is a small minority. For most people, they can use both types. The physical sunscreens have ingredients like zinc and titanium. They act more like a reflector. The chemical sunscreens have ingredients like avobenzone and octisalate. They have to be absorbed in the skin, and that's why we tell patients to try to put them on 30 minutes before sun exposure. But most importantly, whatever sunscreen you choose, or whether you choose to wear clothing like rash guards and other clothing that's SPF 30, just remember to try to protect your skin on a daily basis. And if you have any other questions about products, just let your provider know.